Okay, so trying to really get a handle on improving healthcare quality,
Mm-hmm.
sometimes I feel like you're just swimming in information,
No, it's
right?
absolutely. So many theories, so many different approaches. It's easy to feel a bit overwhelmed.
Yeah, like you're not quite sure what's really important to focus on.
That feeling is totally understandable. I mean, healthcare is incredibly complex. Making real improvements, that takes a very thoughtful approach.
Exactly. And that's why we're doing this deep dive today.
Hmm.
We want to zero in on two concepts that, honestly, often get kind of lumped together,
Mm-hmm.
but they're actually pretty different, especially when you're trying to make healthcare better, change leadership, and change management.
And, understanding that difference, it's actually critical if you want to know how lasting improvements really happen
Right.
and how to make sure they actually stick around.
Yeah.
Knowing when you need leadership versus when you need solid management, well, that can completely change the game.
So it's the key to real transformation, not just like surface level tweaks.
Precisely. Not just temporary fixes.
Okay, good. So to really get this straight, we've pulled from quite a few places. We're looking at info from Joint Commission International, NABH, that's the National Accreditation Board for Hospitals and Healthcare Providers.
Right, and ISQA, the International Society for Quality in Healthcare, plus Supremediq Consultancy.
And we also dug into a couple of specific pieces, change management and change leadership in healthcare quality improvement projects, and episode 57 of the QI Playbook, which was all about this exact topic.
So a really good mix of sources. Our mission today really is to clarify these two things, change leadership, change management, specifically for healthcare.
Yep, what they are, and maybe more importantly, how they need to work together for quality improvement to actually work.
And hopefully you'll walk away with some practical insights you can use.
Okay, let's dive in. Change leadership first, it feels like. Well, it feels like it's about setting the big goal, the vision, and getting people fired up about it.
That's a great starting point. Yeah. Our sources consistently frame it that way. It's about establishing that clear picture, where are we going?
And then inspiring people to actually want to go there. And crucially, fostering a culture where, learning and improving is just normal, part of the everyday.
So much more about the big why than the day-to-day steps.
Exactly. It's about shifting mindsets. Like the QI playbook talked about creating a genuine safety-first mindset, that kind of deep cultural shift
Yeah.
that has to be led.
Yeah. That feels like something that has to come from leadership, doesn't it?
Absolutely. And change leadership is most critical when you're trying to make those big shifts. Shifting the culture, like we said,
Okay.
or bringing in something really new or disruptive. Think about a major digital transformation, like implementing a whole new EHR system across the board.
Big stuff.
Or driving a really long-term transformation, like moving towards value-based care models.
Yeah.
That requires sustained leadership. The QI playbook had that great line, leadership captures hearts and minds.
Hearts and minds. I like that. It gets people to really believe in the change, not just comply with it. Precisely. And the sources, particularly change management and change leadership, they really stress the leader's role in creating and communicating that vision.
So not just having the idea, but really selling it.
Selling it, explaining why it's necessary, what the benefits are, basically telling a compelling story about where you're heading.
And it's not just talking, right? It's about empowering people too.
Exactly. It's about making staff feel like they're part of it, that they have a role to play, recognizing their contributions, celebrating the small wins, and really motivating them to try new ways of working. It's about fostering that continuous learning culture where it's okay to experiment, maybe even fail sometimes, as long as you learn.
Okay, so leadership sets the direction, gets everyone inspired and pointing the same way. Makes sense. Now, let's flip to change management. This sounds more like the practical side, the actual doing.
You nailed it. That's exactly how our sources describe it. Change management is the practical implementation.
The how and when.
Right, the how and the when of the change. It involves all the detailed planning, organizing the resources, the step-by-step rollout of new processes or protocols.
So if leadership is hearts and minds, management is.
Steps and systems. That was the analogy from the QI playbook, and it fits perfectly.
Steps and systems. Yeah, I can picture that.
And they pointed out it's absolutely key when you're doing things like, say, rolling out new standard operating procedures.
Or clinical pathways, maybe.
Exactly. Anything that requires coordinating tasks, hitting specific milestones, ensuring accountability, making sure things actually get done properly.
Okay, so what are the key activities involved in change management then? What does it actually look like on the ground?
Well, change management and change leadership, breaks it down pretty well. First up is strategic planning.
Right.
That means developing detailed plans, clear goals, realistic timelines, figuring out the resources you need, and having a solid communication strategy so everyone knows what's happening when.
Laying out all the pieces. Got it. What else?
Stakeholder engagement. This is huge. Identifying everyone who's going to be affected.
Doctors, nurses, admin, maybe even patients.
Absolutely. And not just identifying them, but actively involving them. Listening to their concerns, addressing their questions, really working to get their buy-in.
Because if you don't, they'll just resist, right?
Pretty much. Imagine rolling out a new charting system without talking to the clinicians who have to use it every single day. It just won't work well.
Makes total sense. Okay, planning, stakeholders. What else?
Training and support. Can't forget that. Staff need proper training on any new ways of working, new tech. And they need ongoing support as they adapt. It's not usually a one-and-done thing.
Right.
Then there's monitoring and evaluation. You have to track progress. Are we hitting our targets? Are the changes having the intended effect? Using key metrics to see what's working and what's not.
So, constantly checking in and adjusting course if needed.
Exactly. Which leads to the final piece, adaptation and improvement. Being flexible, using the feedback and the data you're collecting to tweak the process, keep it relevant, make it better over time.
Okay, so, wow. We've got the vision and inspiration from leadership, and then the detailed planning, execution, and monitoring from management. It seems, pretty obvious you need both, doesn't it?
Absolutely essential. Every source we looked at hammered this point home. They aren't optional. They're two sides of the same coin for any successful quality improvement effort.
You can't just have one.
Not effectively, no. Neglecting leadership means you might have a plan, but no real buy-in or motivation. Neglecting management means you might have an inspiring vision, but no practical way to get there. Chaos ensues.
The QI playbook had that great example, didn't they? With Dr. Roll about discharge delays.
Yes, that was perfect. They started with just management, new SOPs, spreadsheets, tracking.
The steps and systems.
Right. But it didn't really work. Not until leadership stepped up and framed the goal differently, made it meaningful.
How do they do that?
By connecting it to the bigger picture, freeing up beds for critically ill patients waiting in the ED. Suddenly, it wasn't just about paperwork, it was about patient care. That's the leadership piece igniting the management plan.
Ah, okay. That really shows why you need that why before the how really clicks for people.
Exactly. The management provides the structure, leadership provides the meaning and motivation for that structure. And think about the reverse, too.
What do you mean?
Well, you could have a really inspiring CEO talking about patient-centered care, great leadership vision. But if the rollout of, say, a new patient feedback system is completely disorganized, training is bad, the tech is glitchy, that poor management undermines the whole thing.
Yeah, people get cynical fast, don't they?
They do. So that QI playbook comparison table was useful too, just to quickly summarize.
Right. It broke it down. Leadership focus.
Yeah.
Vision, people, mindset. Management focus. Tasks, timelines, logistics.
Leadership role. Inspire, influence. Management role. Plan, organize, control.
Different tools, too.
Yeah.
Leadership uses things like town halls, storytelling.
Role modeling.
Right. Well, management uses SOPs, checklists, KPIs.
The practical tools. And the outcomes differ too. Leadership aims for engagement, that culture shift. Management aims for execution, hitting those measurable outputs.
And it even mapped to typical roles. CMOs, CEOs leading the charts.
Heads, yeah.
Well, quality officers, project managers handle the management side.
Generally, yes. Though, obviously, there can be overlap. But it paints a clear picture. Leadership sets direction and inspires. Management executes effectively.
Understanding that distinction, that interplay, it feels like a really powerful framework for anyone involved in quality improvement.
It really is. It helps you diagnose problems, too. If a project is stalling, you can ask, is it a leadership gap? Or is the management side falling short? Or both?
That's a great point. What would be some red flags? Like, if a project's struggling, how could you tell if it's a leadership issue versus a management one?
Good question. On the leadership side, red flags might be, well, a lack of a clear vision that everyone understands. People might know what they're supposed to do, but not really why.
Or maybe low morale, resistance.
Exactly. A sense that leaders aren't really committed, they're just saying the words. On the management side, red flags are often more concrete.
Right.
Like poorly defined plans, missed deadlines all the time, confusion about who's responsible for what, not enough training, no real tracking of progress. It just feels chaotic, disorganized.
Even if the initial idea was good.
Right. Good idea, poor execution, that's often a management failing.
Okay, so let's make it even more real. We talked discharge delays.
Yeah.
What about something like implementing a big new electronic health record system? How would leadership and management play out there?
Oh, that's a classic massive change initiative. Okay, so leadership. That would be the CEO, the CMO, maybe other senior leaders really articulating the strategic reasons.
Like improving safety
Yeah.
or better data sharing.
Precisely. Painting that picture of a more efficient, safer future because of this new system. Addressing the inevitable anxiety by focusing on the long-term benefits for staff and patients. Getting everyone to see the destination.
But what if the leaders themselves aren't, totally aligned? If they're sending mixed messages about the EHR?
That's a huge problem. Lack of unified leadership vision is often fatal for big changes. It creates confusion, kills momentum, undermines trust right from the start, makes the management team's job almost impossible.
Okay, so assuming leadership is aligned, what's the management side of the EHR rollout?
That's all the detailed stuff. Project plans with thousands of tasks, IT teams setting up servers and networks.
Training schedules for everyone.
Yep, massive training programs, strategies for migrating mountains of old data, setting up help desks and ongoing tech support. That's the complex how-to of making the system actually work day to day.
Wow. Yeah, you absolutely need both for something that big.
You really do. And think about that infection control example from the playbook, too.
Right, hand hygiene.
The leadership bit was the infection control lead sharing a powerful, maybe emotional story about a patient harmed by an infection.
Making it personal.
Yes. And setting that bold aspirational goal. 0 preventable infections. That's leadership creating the emotional connection and the ambitious target.
Definitely the hearts and minds. So the management was
putting up the posters, the hand sanitizer stations everywhere, doing the regular audits, tracking the compliance rates week by week, the steps and systems again.
Exactly.
Yeah.
Leadership created the why. Management provided the how to get towards that 0 infections goal.
It makes you think about organizations like JCI or NABH. Their whole mission is about affirming high standards for quality and safety.
Right.
Achieving those standards must require both, right? Leadership pushing for a culture of excellence, and management putting the actual processes in place to meet the requirements.
Absolutely. Accreditation bodies set the bar high. You can't meet those standards without both top-level commitment, that's leadership, and the operational systems to back it up, that's management. And the fact that you have global groups like ISQA focused on this stuff, it shows this isn't just a local issue. Understanding leadership and management for change is fundamental everywhere in healthcare.
It really is a universal challenge and opportunity.
And even companies like Supremediq offering services like, implementing quality management systems or helping with NABH accreditation, they're focusing on those practical management pieces.
The tangible systems.
But as we've been saying, those systems are going to be so much more effective if they're built on a foundation of strong leadership, a clear vision, and a team that's actually motivated.
Couldn't agree more. You can have the best processes on paper, but if the team doesn't get why they're doing it or doesn't feel inspired to do it well, compliance will be patchy and you won't see the real benefits.
So that leadership why is the essential groundwork for the management how.
Beautifully put. That's the core relationship.
Okay, so wrapping this up, the big takeaway seems pretty clear. Change leadership. It's the vision, the inspiration, the people side. Change management.
Yeah.
It's the structure, the plan, the execution.
That's it in a nutshell. And sustainable, real quality improvement, it absolutely hinges on getting both of those working together effectively. You just can't have lasting success with only one.
This has been really clarifying, actually, making that distinction sharp. So for you listening, here's something to maybe chew on.
Yeah.
Think about the healthcare places maybe where you work or where you've been a patient. Can you pinpoint examples? Where have you seen really strong change leadership or maybe weak leadership? And same for change management. What were the results? When both were strong, what happened? When one was missing?
That's a great reflective exercise. Seeing it in the real world really cements the ideas.
Yeah. And maybe think about what role you could play, leading change, managing it.
Or maybe supporting both. It's a continuous journey, this whole healthcare quality improvement thing.
Definitely feels like it. And having a solid grip on these ideas leadership, management seems pretty fundamental to navigating that journey well.